morning. My name is Mimi Roberson. I'm the Chief Operating Officer of Well Advised, and I have the privilege of having Alan Billings here today with me. He's our Chief Executive Officer. I am located in Denver, Colorado, and Alan is in San Francisco, California. So my name, as I said, is Mimi Roberson. I am currently with Well Advised, and I served the past 30 years in healthcare, both as a medical malpractice defense attorney and most importantly, for 25 years as the executive of 4 hospitals. So my perspective is very well rounded on healthcare, and I was very proud and privileged to join Well Advised because it spoke to me in so many ways about what the needs in our communities are, whether we live in Colorado, California, or anywhere else. So Alan, why don't you introduce yourself as we get started?
I will. Thank you, Mimi. And thank you everyone for joining us. I would like to start off with an introduction myself through a quick story that helps to cue up the topic that we're talking about, Medicare mistakes to avoid. The company Well Advised was originally founded by Dr. Robert Morris, and Dr. Morris had served as a physician and then later as a medical director and then CEO of a hospital, and was ready to retire. And as he went into retirement, he discovered that the process of enrolling in Medicare was overly complex. And he had a hard time himself finding a plan and decided, you know what, if I'm struggling with this problem, it's very likely that other people are struggling as well. And decided that he would start a company to use technology to help solve some of the challenges in Medicare. About that time, Robert contacted me and I began to collaborate with him, and he asked me to join the company. And so as often happens with career decisions, I went and spoke with my dad. Now, I had spent a number of years in technology development, had launched a startup previously in healthcare, but I wanted to get my dad's advice on Well Advised. A little background on my dad: he's an engineer, spent his whole career building various products. And he's the kind of guy that if you come home and the dishwasher's broken, the dishwasher is likely to be disassembled all over the kitchen floor and he's figuring out how to fix the thing. So I thought, you know what, if there's anybody I know who would dive in and figure out the details of Medicare and how it works and make sure he signs up for the right plan, it's my dad. So I gave my dad a call and I said, you know, how did you go about finding the Medicare plan that you ended up on? He was 83 years old at the time and had been on Medicare for several years after retiring. And he said, you know what, he was a little bit shy about this, a little bit embarrassed. And he said, he goes, I dove into that thing. I created spreadsheets and tried to figure it out. And the end of it, I threw up my arms, went to the AARP website and signed up for the plan that they recommended. So it turns out, as you'll see later, my dad made several of the mistakes that we're advising people to avoid. And that was the sign to me that, yes, this is a problem worth solving. If someone like my dad, someone like Dr. Morris is having a hard time making sense of Medicare, then it's likely a lot of other people are as well. So with that background, let's dive into it. I think the first thing to consider is, let's see, I'm trying to control my screen, is really why are mistakes common in Medicare? Now, we all know kind of at a high level, understand that it's complex and confusing, but I think a lot of people don't understand really how complex and how confusing it is. First of all, the structure of Medicare is difficult. It's not obvious. You have you have all the various parts of Medicare. Medicare is administered by the federal government. You sign up for it through Social Security, and yet many of the plans that are offered are plans that are delivered by private insurance companies. And not all of that is obvious to people who are first signing up for Medicare. Secondly, the language is obscure. You have Medicare Parts A, B, C, D, If you look at Medigap plans or Medicare supplement plans, you'll have Medicare supplement parts A, B, C, all the way through M or so. The language around premiums and out-of-pocket expenses and various other aspects of Medicare is also confusing. Also, enrollment is not the same for everyone. One person may get automatically enrolled in, for example, Medicare Part B, but someone else may not be. And then finally, there's overwhelming choice. In a typical market in the US, there are over 5,000 plan options. And so if you think about the complexity, you'd not only have to decide, am I going to choose a Medicare Advantage plan, or am I going to choose original Medicare with a Medicare supplement plan? I also need to pick out a drug plan. And if you look at all of the combinations of those options, over 5,000 combinations in a typical market. So there's no wonder that experts have found that over 94% of the population is enrolled in the wrong plan. And by wrong plan, that means what? Well, let's take a look at some of the mistakes, the impacts of the mistakes in Medicare. First of all, of course, you could end up with the wrong coverage, which means you don't get the benefits you need. You may not have the doctors in network that you want to see, whether it's a primary care doctor or specialists for any given condition or surgeries that you may need, or the prescription drugs that you need either now or in the future are not covered or are covered at a higher price point than other plans that are available. And then, of course, you can end up paying too much. The monthly premiums are too high. Your overall out-of-pocket costs are too high, and you may incur enrollment penalties if you don't manage the Medicare enrollment and sign-up process properly. So with that background, let's dive into a few definitions, and then we'll take a look at some of the most common Medicare mistakes that we've seen in the marketplace. First of all, let's talk about the definitions. And I want to preface this by saying we do have another course that we offered called Medicare 101. And this was an online event that we delivered several weeks back. If you're interested in a deeper dive on some of the basics of Medicare, how it works, and the various definition and aspects of Medicare, I invite you to go to our website, which is well-advised.com, and we have a recording of that online event available there, or you can do additional research at places like medicare.gov and elsewhere. But for today's conversation, let's just talk about some of the basic definitions of Medicare and the various parts in Medicare. First of all, there are the parts you'll hear: Medicare Part A, Part B, Part C, and Part D. Those refer to various aspects of coverage. Medicare Parts A and B are referred to as original Medicare. Part C is the nomenclature that's associated with Medicare Advantage plans, and you may hear Medicare Advantage very commonly in the marketplace because it's highly promoted. And Medicare Advantage is essentially a managed care plan. And so that's an approach that you can take to your coverage. And then, of course, Medicare Part D refers to the Medicare drug plans. Now, one of the primary decisions, and we'll cover this later in further depth, is the decision that needs to be made between Medicare Advantage and original Medicare. Medicare Advantage is an approach that the government fairly recently introduced that is managed care based, and these are plans that offer comprehensive coverage from a managed care perspective, and often include drug plan coverage within those plans. Medicare Advantage is the program that gives insurance companies the opportunity to define a physician or provider network and decide which providers are in that network and not in that network based on the relationships and partnerships that they have with various provider groups. Similarly, or in contrast to that, are Medicare supplement plans. And Medicare supplement plans are plans that go along with original Medicare, and they are meant to really kind of fill in the gaps of the coverage from the original Medicare program that was put into place with Medicare Parts A and B. And so the decision that needs to be made when someone is signing up for Medicare, and also when they are reviewing their plan options later in life, is really, do I go the path of Medicare, original Medicare, with a supplement plan to cover my needs, and then also a drug plan to cover my prescription needs, or do I go the path of Medicare Advantage? And we'll look into that in a little bit more detail under the Medicare mistakes, because this is a key aspect of it. Okay, so moving on from there, let's dive into the actual common mistakes. Mistake number one. Mistake number one is not understanding that decision, as I described, the original Medicare versus Medicare Advantage. The Medicare Advantage plans are highly promoted in the marketplace, both by the federal government as well as insurance companies, and often they're priced fairly low. However, these plans also have considerations around provider networks. Someone who is on an original Medicare plan with a Medicare supplement plan can go to any provider, that takes Medicare of any sort. So the network options under original Medicare are a lot broader. There are also travel implications and additional plan benefits. The key thing to understand, the main punchline is, if you sign up for Medicare Advantage, you may not have the opportunity later to sign up for original Medicare with a Medicare supplement plan because of something that's called guaranteed issue. When you first go onto Medicare, you can sign up for a Medigap plan, and that insurance company has to let you enroll in that plan. If you choose not to and go onto Medicare Advantage instead, and you later decide to go back, then you may not qualify for that plan, because the provider can then put you, or the carrier can then put you through underwriting and determine your eligibility for the plan. So mistake number one is not understanding those complexities. So what can you do about it? Really, this is the one that's difficult. You need to learn more about the options, particularly in your area. Plan availability varies by county in the US. You need to consider all the Medicare supplement plans that are available, and then weigh considerations like, do you travel a lot? Is your provider in network? And other plan benefits when you're making the decision. The punchline is, if you need to, get help. And this is where Well Advised comes into play. We do have resources available for our consumers to help them in the process of making this decision. So mistake number two, not enrolling in Medicare Part A when you can. Now, most people, as they enter Medicare, have been on an employer plan, and some continue to, after age 65, stay on that plan. However, Medicare Part A is free, so there's no reason to delay enrolling in Medicare Part A. It will help you reduce your inpatient costs, even if you are currently covered under your group insurance or your employer insurance. So what you can do about it simply is enroll in Medicare Part A when it's available to you. It's free of charge anyway, and it can help lower your cost. Mistake number three is kind of the reverse of this. For Medicare Part B, which covers hospital expenses and other emergency care, a lot of people don't understand the complexity of signing up for B. Part B, if you're covered by an employee health plan already, you don't need to sign up for Part B. Now, as opposed to Medicare Part A, there is a premium for Part B. So what you want to do is wait until your current insurance expires, and then you sign up for Medicare Part B. but it is important that you do sign up at that point in time to avoid penalties. So if your current insurance expires and then you let a period of time go by, you could incur penalties. So not enrolling Part B at the right time is mistake number 3.
So Alan, with regard to that, we had one of our questions from participant Greg asked that specific question about, he went on to register for Medicare today because he turned 65 in 3 months. He could not complete because he was indecisive about signing up for B. He will be continuing with his company insurance for 2 years and went until he retires. So his proposition was, I guess that I should not register in Part B until I have insurance coverage. Could you comment?
You
So
you
what
should not
what you
register.
just said, like stick on your regular, do plan A for certainly, because there's no reason not to, but
Yes.
hold off on the plan B, but make sure you're enrolled in a timely fashion on B when you are transitioning off of your employee plan.
That's right. When you're covered by your employee plan, you don't need to enroll in Part B and it doesn't help you. But once your employer plan ends, then you need to enroll in Part B promptly to avoid penalties.
Okay, thanks.
You bet. All right. Mistake number 4 is also similar, and this is for Medicare drug plans. And this applies to people who are signing up or using original Medicare, possibly along with a Medicare Advantage plan. A common comment that we hear is, I'm healthy today and I'm not taking drugs, so why do I need to go out and spend money on a Medicare drug plan? Well, the answer is because you may end up paying a lot more later. The way that Medicare Part D works is that if you are not covered by a drug plan for a period of time, you're not paying into the system. And because you're not paying into the system, when you do then need Part D and sign up for it, you'll pay a higher premium because of the penalties that Medicare put into place. So what you can do about that is really understand this complexity, enroll in Part D when your current drug coverage ends, to avoid the penalties that are incurred. Now keep in mind that Medicare Advantage plans, many of them include drug coverage. So this applies if you're on a Medicare supplement plan, not a Medicare Advantage plan that has drug coverage. All right, moving on. Mistake number 5 is not accounting for upcoming surgeries or other care needs. So this goes back to the decision around original Medicare versus Medicare Advantage. If you know that you have, for example, an upcoming surgery, I know a lot of common ones are, people have hip problems, or, I know for myself, I had rotator cuff surgery several years back. For me, there was a particular surgeon that I wanted to have the work done with. It's important to understand that before you sign up for Medicare. If you end up on a Medicare Advantage plan, you've got to make sure that the doctors you want are in your network, the specialists, as well as any preferences you have around post-surgery services like occupational therapy, physical therapy, and other in-home care, other considerations. If you stick with original Medicare with a supplement plan, then those challenges go away because any specialist that takes Medicare will take original Medicare with a supplement plan. So what you can do about it is really carefully consider that decision around Medicare Advantage versus supplements, and then research the coverage options in your area. And
sure. Alan, let me jump in on this one. As a hospital administrator, what we found to be prevalent was we had the privilege of accepting a lot of patients from out of state or that lived in rural areas and were transported into more of an urban setting. And they did not know which questions to ask. And so we have some information like that on our website, but are the anesthesiologists covered? Are the anesthesia radiologist, those kinds of ancillary services that are embedded in a surgery, we think about our surgeon, and we don't necessarily think about who else may or may not be participating in our coverage. And as you said, post-surgery, from the rehab, occupational therapy, those become pretty important questions to ask, easily solved, but they become a mistake if you don't know to ask in advance.
That's right. Good insight. Thank you, Mimi. All right, mistake number 6 is this is another one that we commonly see. It's choosing a plan based solely on the insurance company. Now, this is the mistake my dad made. He got frustrated with Medicare. He talked to a few friends of his, went to the AARP site and just said, you know what, AARP knows what they're doing. They work with United Healthcare. That's who I'm going to sign up for. The challenge is, and we see this in the marketplace all of the time, is the pricing can vary significantly from plan to plan. We've seen plans that have the identical coverage that are sometimes 2 or 3 times higher than other plans for this exact same coverage in terms of their monthly premium. There are also big variances in terms of network, of course, and what is covered under the plans. And by selecting based on just the reputation of the insurance company, you're narrowing that 5,000 choices down to 3 or 4 or 10 at the very most. And that's not almost never going to work out in your benefit. So what you can do about it, of course, is you need to consider all the carriers in your area and of course be aware of not just the current pricing, but how the pricing may change over time. Which brings us to mistake number 7 and the last of our group, and that is not switching plans when you can change to a better option. Very often, most people, because of how painful and difficult Medicare is to a lot of people, once they enroll in a plan, they often stick with that plan indefinitely. The problem is pricing, network coverage, and the conditions that are covered by the plans themselves change significantly year over year. One of the things that we've seen with several carriers is they may offer a plan with a very low premium today, but they have to disclose the future raises in the premiums that they're planning under those plans. And often there are carriers that significantly hike the price points up in future years, much more than other carriers. So it's very, very important from both a pricing and a coverage perspective to review your plan year over year. So of course, what can you do about it? Consider all the carriers in your area, and do that every single year, and then be aware of this kind of underlying trick that some of the carriers play, where they'll change the pricing. They'll offer a very low plan with the objective of getting as many people into that plan as possible, and then they'll raise the prices on it later, knowing that people are not as likely to switch plans in the future.
Yeah, and on a personal level, I found that every time I was overseeing a lot of the care for my mom and her twin sister, as well as my mother-in-law, and they lived in 2 other states. And so when I got involved, I realized that these things were happening. And when I asked my mother about it, she said, well, I'm just going to pay it because I don't think I can change. So I think that was one of the issues that Dr. Morris had identified on the front end when he created this was, yes, you can change, but how do you do it? And how do we enable people to do it very simply?
That's right.
So that's great. So Alan, we have 2 questions that were sent in advance. And if we have time, I would love to answer another one that came in that I think we can do very easily. So if we are mindful of time, we can probably knock out all 3. So the first one was, I currently have Medicaid, and I wonder if I can continue having Medicaid in addition to signing up for Medicare.
Excellent. So yes, the short answer is yes, as long as you qualify. Now, when I say as long as you qualify, that is decided on a very local basis, state by state, and sometimes county basis. But typically, there's an option called dual eligibility, and it means that you are eligible for both Medicaid and Medicare, and you can sign up for a dual eligible plan. Those plans are in the form of Medicare Advantage plans and are typically available in the marketplace. Now, one thing to keep in mind as you're making that transition is you want to be in charge of making the decision of which dual eligible plan you sign up for. Because if you don't, the government may, in some cases, automatically sign you up for a Medicare plan that is paired with your Medicaid plan, and it may not be the one that best meets your needs. So, so the first thing to do is check and make sure you are eligible for a dual plan. And then the second thing is to, once you are eligible, select the right dual plan to make sure that you meet the needs.
Can that kind of level of detail happen on our tool? If people go on the free tool?
Yes, it can, and I'll talk about that in a minute. What Well Advised offers is a free online tool that you can use to put in your preferences and needs, and then we have a technology engine that is supported by a staff of experts that does the analysis on your needs and makes a recommendation for a plan for you in your area.
Okay, let's get to the next question then, Alan.
Okay.
It's a two-parter. The first is, when would you recommend a supplement plan over an advantage plan?
Okay, so this is one of the most complex aspects of Medicare. And unfortunately, if you go to medicare.gov or some other site that does an analysis of what recommended plan that you should get, they kind of make it look like this is a simple ask a few questions and make a decision, and it's not. Generally speaking, we will, at a very high level, we will recommend a Medicare supplement plan over Medicare Advantage if you have the financial resources to afford it. And the reason for that is just very simply, it gives you more options. Those plans are less restrictive. You can get care in other locations. You can get care overseas. If you live in multiple places or you travel a lot, that's a very strong consideration. Many cases, Medicare Advantage plans, you'll be out of network if you need care outside of your main area. Pricing is a consideration. The availability of the specialists and doctors that you need is a key consideration. If you can't find a Medicare Advantage plan that has the doctors you want, then we would recommend a Medicare supplement plan. And then there are a number of other considerations.
Okay. So with that in mind, if you do recommend a supplement plan, would you also get a Plan D pharmacy at the same time?
Yes, the answer is yes, because even if you don't, and that was covered in one of the earlier questions. If you don't necessarily need medication coverage today, you will avoid penalties by signing up with a Part D plan.
Okay, and we have one very, very quick one from Heidi that I think we can snitch in before we leave.
Okay.
Can you enroll in a drug plan if you enroll in an Advantage plan?
Yes, if your Advantage plan does not include drug coverage, then you can enroll in a drug plan. But typically, the majority of Medicare Advantage plans do include drug coverage.
Right. So you don't need both of them, right?
You don't typically need both.
But I think the critical part of that also is to look within those Advantage plans with the prescription drugs. What do they do or do not include? Because if you are on some specialty drugs, if you have a medical condition that requires pretty fancy drugs, then you really need to make sure that those are covered in whatever Advantage plans you're enrolling in.
Yes.
Yeah. Okay. Well, that's it for the questions that were submitted in advance, Alan. So if you would kindly guide us to the next final steps, and we can thank our participants.
Excellent. Thank you. Yeah, so as you can see, we've got, you've learned hopefully a number of things today. There are a lot of pitfalls with Medicare. but at the same time, it is something you can get your arms around. The good news is there are a lot of good plans available, and it shouldn't be something that causes too much anxiety. We do offer additional help. If you go to welladvised.com, we have a technology solution that is unbiased, confidential, doesn't cost you anything, where we can give you a recommended plan. If you choose to do so, we can also help facilitate the enrollment process. So that's, that's my sales pitch. If you choose not to, that's fine as well. But what we hope to be is a resource for you as you're making this important decision, either now or in future years. Also at welladvised.com, you can find recorded past educational events like this one. So you can go and learn more about Medicare. We cover a number of other topics, including, as I mentioned before, the one about Medicare 101, that's an introduction to some of the basic concepts. And then we have tools like a Medicare enrollment checklist that you can download and print and look through to help you as you're going through your process. And then finally, if you have any additional questions, contact us at info@well-advised.com, and we'd be happy to answer any other questions.
Okay, so Chris had also sent a question in, and Chris, if we have your email address, we will be happy to answer your question directly to you. It's about pre-existing conditions. It's really not a question, so I'm not really sure what you're looking for. So if you have any specific question, we would be delighted to answer your specific questions or provide guidance for you at well-advised.com, because I don't want you to feel like you are not being heard. So that's it for today for this webinar. We will continue to have webinars every Tuesday at 11 o'clock. And if you want to join in any of those, we'll make sure to get you on the list for that. And likewise, if you have some specific questions or guidance that you wish we would cover, not all of these will be 30 minutes. Some can be as short as 5 minutes, 10 minutes, 20 minutes. So we'll make sure to be able to keep you all in the loop and help get you the education that you need. So on behalf of Alan Billings and myself, we wish to thank you. And I want to thank John Hoagie, who set this up for us, one of our team members. And we look forward to being of service in the future. So thank you, Alan. Thank you to all of our participants. Bye-bye.